What happens during a neuromelanin MRI? Have you ever wondered how doctors can see changes in the brain related to Parkinson's disease? One exciting method is called neuromelanin magnetic resonance imaging. This specialized imaging technique focuses on a pigment called neuromelanin, which is found in specific areas of the brain. These areas include the substantia nigra, ventral tegmental area, and locus coeruleus. Neuromelanin accumulates in certain brain cells as a byproduct of dopamine metabolism. It plays a protective role by binding iron, which is significant when studying Parkinson's disease. During a neuromelanin MRI, the patient lies inside a standard MRI machine. However, this scan uses special imaging sequences that are sensitive to the magnetic properties of neuromelanin, particularly its iron content. This means that the machine can create detailed images of the brain without needing radioactive tracers or contrast agents. The imaging captures the volume and contrast of areas rich in neuromelanin, especially the substantia nigra, which is crucial in Parkinson's disease. The process begins with the patient undergoing a routine MRI scan. The neuromelanin-sensitive sequences detect neuromelanin based on its ability to bind iron. Advanced image processing techniques may then be applied to map the distribution of neuromelanin and quantify its volume and integrity. The resulting images provide important biomarkers that reflected the health and density of dopaminergic neurons. These neurons are known to degenerate in Parkinson's disease. Moreover, neuromelanin MRI can also reveal changes in brain iron levels. As neurons that contain neuromelanin degenerate, iron levels often increase. This information is vital because it helps differentiate Parkinson's disease from other neurodegenerative disorders that may present similar symptoms. Importantly, neuromelanin MRI can aid in early diagnosis, even before motor symptoms appear. One of the best aspects of neuromelanin MRI is that it is non-invasive and does not expose patients to radiation. It can be easily integrated into standard MRI protocols, making it a cost-effective option compared to other imaging methods like dopamine transporter scans or single-photon emission computed tomography. Clinically, neuromelanin MRI is valuable for monitoring the progression of Parkinson's disease. By tracking the loss of neuromelanin and the accumulation of iron in the substantia nigra, doctors can gain insights into the early stages of the disease. In fact, more than 50% of dopaminergic neurons may already be lost before motor symptoms become apparent. In summary, during a neuromelanin MRI, specialized MRI sequences detect neuromelanin and its associated iron in key brain regions affected by Parkinson's disease. This produces images that serve as biomarkers for neuronal integrity and aid in disease diagnosis without invasive procedures or radiation exposure. This technique holds great promise for improving early diagnosis, differential diagnosis, and monitoring the progression of Parkinson's disease.